Hello everyone, I am Dr. Ekta Bhushan, teaching Anatomy and Physiology of Exercise at Indira Gandhi Institute of Physical Education at Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine. But today in particular, we will discuss the topic hydrotherapy. So, hydrotherapy or water therapy is a complementary therapy that uses water for health purposes. Depending on the industry and use, some may also refer to the treatments as aquatic therapy, water therapy, or hydropathy. There are many uses of different types of hydrotherapy, including treating joint pain with water exercises and easing muscle stress with cold or hot showers or bath. People should always discuss hydrotherapy with a doctor or physical therapist before adding it to a treatment program. Hydrotherapy has lots of advantages, can be a great way to reduce symptoms without medications or other more invasive treatments. If you receive hydrotherapy from a licensed certified provider, hydrotherapy is a very safe and has little to no side effects. Avoid any treatment that says remove toxins or cures diseases. So let's see what is hydrotherapy in a defined way. Hydrotherapy refers to use water as a therapy in any form. For instance, it may act as a treatment for temporary skin-related issues such as burns and septic ulcers, or for chronic health conditions such as arthritis and fibromyalgia. So, water therapy uses either hot or cold water with the water pressure and flow varying among treatments. The intention is to ease both physical and mental symptoms. Some hydrotherapy practices are as simple as sitting in a warm bath, which people can do at home. Other practices involve specialist locations or equipment such as cold sauna or hot sauna. So, possible locations and equipments for hydrotherapy may include physical therapy tanks, swimming pools, whirlpool spas, hot tubs, saunas, showers, baths. The procedure for using each will vary greatly depending on the goal of treatment and the practitioner. So, why is hydrotherapy used? Hydrotherapy is primarily used to relieve symptoms like pain and stiffness. Your provider might suggest a form of hydrotherapy as part of your broader treatment or symptom management plan. Hydrotherapy can help people with these symptoms feel better: pain, stiffness, bruising, swelling, muscle pain, menstrual pain. So, what does hydrotherapy treat? People with several conditions can benefit from using water in different forms and at different temperatures to feel better. Hydrotherapy can provide symptomatic relief to people with the following conditions like osteoarthritis, fibromyalgia, Parkinson's disease, neuropathy, ankylosing spondylitis, multiple sclerosis, cerebral palsy. So, it's important to remember that hydrotherapy doesn't cure any of these conditions. It shouldn't take the place of any treatment or medications your healthcare provider prescribe you. In most cases, hydrotherapy helps people feel better by temporarily relieving pain, stiffness, and swelling. It's never a bad thing to find a safe way to feel better, but you shouldn't expect hydrotherapy to cure any condition, especially more serious chronic diseases. So, hydrotherapy for burns. Hydrotherapy can help people with burn injuries. Jets of water are an effective and safe way to clean wounds and burn skin. Treating burns with pressurized water can also help reduce pain, redness, scarring, or permanent discoloration. Next is hydrotherapy and physical therapy. So, hydrotherapy can also be a good supplement to physical therapy. As you recover from an injury or surgery, moving in water provides a low resistance way to exercise safely. You will probably heard of water aerobics or swimming as a great option for people who experience pain from other types of workouts. So, always talk to your surgeon or provider before resuming any physical activity after a surgery. Hydrotherapy, tanks, pools, or tubs can increase your risk of infection. You might also need to wait a set amount of time after your surgery before you can get your incision site wet. The next is hydrotherapy and pregnancy. So, hydrotherapy has shown to be beneficial for some pregnant people. One study found that pregnant people with high blood pressure might be able to reduce their risk for complication them with regular hydrotherapy sessions. Some pregnant people, those to labor in warm water, which can increase your comfort and decrease pain and anxiety. Talk to your healthcare provider about what you want included in your pregnancy and labor pain. The next one is hydrotherapy and weight loss. So, the hydrotherapy on its own doesn't cause, stimulate or improve weight loss. However, exercise plans that include working out in water can help you lose weight and improve your overall health. Now, how common is hydrotherapy? Hydrotherapy is very common. If you have ever taken a bath with salt or a bath bombs or relaxed in a cold tub after a workout, you have experienced hydrotherapy. Whether or not you have called it that, more involved form of hydrotherapy are less common, mostly because they require special equipment and facilities. So, what happens during hydrotherapy? So, what happens during hydrotherapy depends on which form you receive. It can be as simple as bath or shower at home. Most hydrotherapy techniques have both at home and home versions and more specialized application done at dedicated clinics. Some of the most common form of hydrotherapy includes baths, soaking in hot or cold water, pressurized jets, applying pressurized water to your body, temperature regulation, applying ice packs, cryotherapy, or packs to or heat sauna, for example, to different parts of your body. Now, let's see what are the benefits of hydrotherapy. We can see in this slide also. It can relieve in pain, boost immunity, elimination of toxins from body, control stress, helpful in arthritis, cure back pain, helpful in headaches, cures sciatica pain or joint pains, cure insomnia, acne, and so on. So, hydrotherapy has a lot of advantages. It can be a great way to reduce symptoms without medications or more invasive treatments. If you receive hydrotherapy from a licensed certified provider, hydrotherapy is also very safe and has little to no side effects. So benefits of hydrotherapy may offer a range of benefits that includes risk and what are the risk of complications of hydrotherapy. Risk of hydrotherapy treatment includes slips or falls or other accidents, burns or frostbite, infection. Because hydrotherapy isn't regulated by the FDA, some claims about that it can help or prevent have spread online. Avoid any treatment that says it removes toxins or cure diseases. These claims haven't been proven in scientifically verifiable studies, are often completely untrue and can be dangerous. Hydrotherapy isn't a curative treatment. It won't cure or fix any disease or condition you have. Now, other benefits. Reducing pain. So, one review from a trusted source found that spa therapy using warm water had a significant pain relieving effect in people with chronic diseases of the musculoskeletal system and connective tissues. The warm water may ease the signal of pain, relax the muscles and increase blood flow, reducing pain in the area. The next benefit is improving mental health. So, the Center of Disease Control and Prevention, that is CDC, from trusted sources, note that water-based activities improve mental health in some people. For example, people with fibromyalgia may find aquatic exercise therapy reduce anxiety and depression. Additionally, many may find that swimming improves their mood and helps release tension through exercise. The next is arthritis symptoms. People with some types of arthritis may benefit from hydrotherapy as well. For example, one study found that people with osteoarthritis in the knee had improved markers of pain and knee function after 8 weeks of aquatic exercises. Another study found that people with rheumatoid arthritis who engaged in moderate intensity aquatic exercises while continue their medications had an improvement in markers of the disease, including lower oxidative stress. The next is low impact. So, one of the key benefits of hydrotherapy techniques such as aquatic exercise is that they are very low impact. People can do these activities in water without putting too much stress on their joint. As a result, people can stick to a workout plan while reducing symptoms such as pain. Then, relaxation. Many forms of hydrotherapy also aid relaxation both physically and mentally. Warm water may help ease tension in the muscles while promoting a relaxed state of mind. Recovering from workouts. So, athletes sometimes use various forms of hydrotherapy in which they alternate between warm or cold water. Many feels that this forms of contrast hydrotherapy helps them recover from hard workout and avoid delay onset muscle soreness. Then pregnancy and hydrotherapy, as we have also already discussed, hydrotherapy may help with the general aches and pains that pregnancy can cause. Some people may choose form of hydrotherapy during a water birth to reduce pain and promote relaxation. research into the benefits and uses of hydrotherapy is ongoing. There is still a lack of evidence to support some hydrotherapy health claims. Then, now we will discuss types of hydrotherapy. So, types includes aquatic exercises. Aquatic exercise is a low impact form of physical activity which typically takes place in a pool using specialist equipment. It all allows people to work the muscles and raise the heart rate without putting much stress on the joint. These exercises routines are suitable for people with arthritis, fibromyalgia, and for older people who may be at higher risk of falling or just find working out easier in the low impact environment. Then warm water baths. So soaking in a warm water bath is a form of hydrotherapy. The person may also add salts and minerals, essential oils or other ingredient to enhance the bath. Then sitz bath. So sitz bath is a shallow bath using either warm or cold water. Practitioners may recommend sitz bath for relief from issues such as cramps or hemorrhoids. Then wraps, compresses and fermentations. So wraps and compresses using hot, warm or cold water are also a form of hydrotherapy. These may provide targeted relief from mild symptoms of support treatment. Then saunas or water circuit therapy. So water circuit therapy or contrast hydrotherapy involves ongoing through a few different forms of hydrotherapy, one after the other, generally alternating between warm and cold water to promote circulation and help ease symptoms. These circuits may vary greatly depending on the practitioners and the persons receiving the treatment, but it could include various techniques such as warm baths, wet or dry saunas, cold plunges or cold baths. So immersion therapy includes warm baths, cold plunges. We can see all these photos as well. Sitz bath, hot tubes with jet massages and whirlpool bath. Now we have come to the conclusion. Natural medicines has many beneficial and culturally significant uses, but make sure you are receiving treatments from certified providers. Naturopathic doctors are trained and accredited by reputable professional associations and medical colleges. Hydrotherapy may have various uses as complementary therapy to standard treatment. Relaxing hydrotherapy practices such as saunas and foot baths may help ease stress and allow a person to relax or alleviate painful symptoms. In each case, it is still important to work with a doctor to determine the most suitable practices for the individual. So, I hope you understood the concept of hydrotherapy and its importance and various methods of hydrotherapy. That's all for today. See you next time. Thank you.